Amanda again, and we are going to review images for my extra credit shoulder trigger, which is an AP with internal rotation, AP shoulder with external rotation, a superior inferior axillary view, and a shoulder PA scapular Y. Not in that order. Okay, so this is the AP projection of the shoulder with internal rotation. And we know that because the lesser tubercle is in profile. And there's a outline of the greater tubercle. The humeral head is also in profile. Normally this part of the acromium's up higher, but I believe that there's a pathology here for this image. We also know that it's internal rotation because there's more overlap in this area here. And again, our joint is a little off center for the collimation, but it'd be good and would not warrant a repeat in real life. When I did my shoulder trigger for this position, I did not collimate down. So there would have actually been more collimation over here to the rib area. Later I thought I didn't have my marker in my collimation, but then when I rewatched my video I realized I did not collimate the first time around. So that's all I can think about for this one, and we'll move on to the next one. Okay, so this is an AP projection of the shoulder with external rotation, and we know that because the greater tubercle is in profile, and we can see the outline of the lesser tubercle, and collimation is good. The joint looks nice and centered. It's a tiny bit to the left of center looking at the image. Humeral head is in profile here. You can see that edge there. And there's more of an open joint here in the glenoid fossa or scapulohumeral joint. And I remembered to collimate on this image when I did my trigger. That's all I can think of to say about this one. Okay, so this is my PA shoulder projection of the humeral head, scapular Y view. We're looking for the glenoid fossa to superimpose the humeral head. And we know that this is a shoulder projection because the humeral head is superimposed with the body of the scapula. The acromion process is lateral and free of superimposition in this area. The coracoid process is below the clavicle. It's also okay if it superimposes. Collimation could have been better on this projection. Seems like the patient wasn't centered to the center line of the IR because the scapulohumeral joint or glenoid cavity is off to the right of the image. You want to see that the body of the scapula, medial and lateral borders are superimposed, and you want to make sure that it is free of superimposition with the ribs, which this one is, although I think looking at these lines, I think that this one, the scapula is just a tiny bit rotated. And I can't think of anything else to say about it. Nope. I think that's it. So this is my supra-inferior axial projection of the shoulder. I kind of manipulated this one on my computer screen. Again, I took all my images from Google Images, if I didn't mention that earlier. And when I got this one, the coracoid process here, and the clavicle and acromion, they were all on the top. So I put it on my desktop and flipped it the way that Christy taught me, which was to hang it the way your thumb goes. And the coracoid process is where it's supposed to be, up above the clavicle here. We have the scapulohumeral joint right in here. Excuse me. The part is centered to the collimation, so that's good. The lesser tubercle is in profile, and you can see the acromion through the humeral head. I'm used to seeing a little bit more joint space here when I'm at clinicals, so I'd question if there was enough of an angle when this projection was taken, but it wouldn't warrant a retake, I don't believe, unless that was the specific area of interest. That being the AC joint, the acromioclavicular joint, and on all the images, soft tissue and trabeculae are part of the criteria as well that I forgot to mention. And again, I'll be getting rid of these images when I'm done filming so that I'm not committing any issues as far as the usage or copyright. that concludes my extra credit shoulder presentation.